And how are you?
You're doing really well here, Neil. And you?
Fantastic. In today's topic, immunity in pregnancy. What are the specific risks to pregnant women when they get infections?
Well, there are several. In the first place, pregnant women tend to run a higher temperature than normal, so in other words, higher than 98.6. So it's hard to recognize an infection in them. The other problem is they tend not to run fevers, so they can get pretty sick before they'll run a fever.
Why is the flu so dangerous in pregnancy?
Well, there are very serious complications. They include pneumonia, which is difficult to manage, and of course, it's hard to treat.
What are the possible complications if you get the flu in pregnancy?
Well, of course, in addition to a long hospital stay, you have a very great likelihood of having a preterm birth.
What are some signs and symptoms of the flu in pregnancy?
Well, tired, sleepy, cough, fever, 100 degrees, chills, headache, muscle aches, runny nose, sore throat, vomiting, diarrhea. All of those are possible.
How do you treat the flu during pregnancy?
Well, of course, stay hydrated. You can take medications for symptoms like Tylenol, although there's a lot of new news about it, but it's probably the safest thing. It's safer than aspirin, safer than Motrin for managing symptoms and fevers. But there are antivirals. The oldest one is Tamiflu, and that's the brand name for oseltamivir. Relenza is a name for a newer medication. It's a brand name, and that you can, it's a powder, you can inhale it. And then there's Rapivab, and that is the newest one, and it is IV.
How long will I be contagious with the flu?
Well, depends on how severe your symptoms are, but it can be 1 day before you get symptoms and 5 to 7 days afterwards. But if you happen to be a little person or a pregnant woman, you can have symptoms more or longer, and you can be contagious for more time.
All right. The best place to go is ruraldocallen.com and safepregnancies.foundation.org and ruraldocallenpodcast.com. Appreciate it, Doc.
Thanks, Neil.
That's the Rural Doc Allen podcast, guys. Take care.